Looking at the bones of the pectoral girdle and the upper limb and the acromioclavicular and sternoclavicular joints, there are some notable differences between the girdle of the upper limb versus the girdle of the lower limb. Evolutionary changes in the function of the upper limb have led one from the upper limb being a tool for locomotion to a tool for manipulation, and consequently we require more mobility. In order for manipulation, we need to be able to lift our arms above our head, out to the side, and so on. Consequently, the pectoral girdle compared to the pelvic girdle is significantly more mobile. This is done by the inclusion of two joints in that region and two bones. There is the clavicle, commonly known as the collarbone, which is a bony strut that holds the upper limb away from the axial skeleton, and attaching to the clavicle or articulating with the clavicle is the scapula, which is a large flat bone that sits over the posterior thoracic wall. Now, the only true articulation between the upper limb and the trunk is via the sternoclavicular joint. So on the medial end of the clavicle, we have a facet that articulates with the sternum, and this forms the sternoclavicular joint. So when we look at the clavicle, as mentioned earlier, the clavicle is a strut that holds the upper limb away from the body. It lies horizontally, passing from the sternum anteriorly across almost to the tip of the shoulder. The medial end that we can see here, this is the medial end, has a facet on it called the sternal facet, whilst the lateral end over here has a facet that articulates with a bony process on the scapula called the acromion. So this is called the acromial facet. The medial end is more bulbous and is larger than the lateral end. The lateral end is flatter, and the medial end is convex anteriorly. So this is going to be my anterior border of my clavicle. This is the lateral part of the anterior border. This is the medial part of the anterior border. Over here, we've got the posterior border of the clavicle. And on the inferior aspect of the clavicle, we can also identify various ridges and bony points. The superior aspect of the clavicle sits subcutaneously, and there's nothing much attaches onto the superior aspect, and so it's a rather bland and exciting bone. The scapula, on the other hand, is a large flat bone, and a flat bone is a bone that typically is in place to protect underlying structures. So it protects the posterior thoracic wall in particular. It's a large flat bone, and again there are a number of notable identifiable processes on the scapula itself. The first thing that we notice is there is a socket on the lateral aspect of the clavicle. So here we can see a socket, and here is the same socket. This is known as the glenoid fossa, and the glenoid fossa is for articulation with the humerus to form the shoulder joint proper. On the costal surface, so on the surface that actually lies on the thoracic wall, we have a big fossa, a big hollow, known as the subscapular fossa. On the posterior aspect, so the aspect of the scapula that doesn't articulate with the thoracic cage, we have again a couple of fossae. So up here we have the supraspinous fossa. We have a fossa that sits above the spine of the scapula. Here we have the infraspinous fossa, a spine that sits below the spine of the scapula. And dividing the two, there is this large bony ridge, which again is palpable. This is the spine of the scapula that can be felt on the dorsal surface of the shoulder blade itself. The scapula continues on laterally, and as the spine of the scapula passes laterally, we have this large process here. This is the acromion process. This is the process that articulates with the clavicle. Anterior and inferior to that, there is a finger-like projection that comes forward underneath the clavicle. This is the coracoid process. Now, this is the only part of the scapula that is essentially palpable anteriorly. It projects forward like a finger just above the deltopectoral groove anteriorly. It lies underneath the clavicle itself. The humerus is the bone that articulates with the scapula to form the shoulder joint, and this is a typical long bone. We have an expanded epiphysis up here and an expanded epiphysis down here with a shaft in the middle, the diaphysis. This large expanded epiphysis contains the head, which is this biconvex structure that form in the ball part of the ball and socket joint. All heads sit on a neck, so here we can see the anatomical neck of the humerus, and at the ends of the neck of the humerus we have two tubercles. We have a smaller one that sits anteriorly, the lesser tubercle, and this large mass of bone laterally known as the greater tubercle. Underneath the tubercles, we have a structure called the surgical neck. Now, this is called the surgical neck because this is the area that commonly fractures on the humerus. It's not a true neck, but it's a region that gets described clinically as the surgical neck. Down here, we have the shaft, and at the lower end of the shaft, we have the expanded epicondyle. So we've got a medial epicondyle there, a lateral epicondyle, and underneath those we've got the articulating points for the elbow. So this is the capitulum here, and over here on the medial side we have this pulley-shaped structure called the trochlea. On the left here we have the anterior aspect of the humerus. On the right we have the posterior aspect of the humerus, and down at the lower end we can see that the trochlea extends all the way around to the back, whereas the capitulum only sits anteriorly and inferiorly. In between the two tubercles at the top there is a groove. There is a large groove here that is identifiable anteriorly. This is known as the intertubercular sulcus, so it's a groove that sits between the two tubercles. It's sometimes called the bicipital sulcus, or the intertubercular groove, or bicipital groove. All four terms are interchangeable. It's called the bicipital groove because one of the heads of biceps passes through here. The long head of biceps passes through that sulcus, through that groove, over the head of the humerus before inserting onto the top of the glenoid fossa.